Good afternoon. Welcome to the daily briefing here at St. Clair County EMA, where we bring you the latest update on the COVID-19 virus. Joined here again today by Chairman Mark Kern and Sam Bierman from the St. Clair County Health Department. And Sam, you got some numbers, and go ahead. That's all I can say.
I know. More numbers, more sad news to report. As of today, the numbers that we are reporting are for St. Clair County residents that have been tested. And we are at 1,988 residents that have been tested. We are at 454 positive test results, which is an increase of 26 from yesterday. And that includes both males and females from 20s all the way up to their 90s. We're at 1,475 negative test results, with 59 test results still pending. And as I said just a moment ago, we do have some sad news to report. We are reporting 3 additional deaths today, so that brings the total up to 30. And those additional deaths, the first is a male in his 80s who did have underlying health conditions. The remaining 2 were both females, both in their 70s, who both had unknown health conditions. And as always, our condolences go out to the families who have lost loved ones to this virus. For our state totals, we are at 256,667 tested, 50,355 that are positive, which is an increase of 2,253 since yesterday. And for deaths today, we are reporting 2,215, which is an increase of 92 since yesterday. The hospitalization numbers for hospitals that reside in St. Clair County, we have 55 patients that are currently admitted due to COVID-related reasons, and 8 of those patients are on ventilators. For our long-term care centers that are in outbreak status, and that simply means 2 or more, and that can be residents or staff with either COVID-positive test results or COVID-like symptoms, Bria of Belleville has 12 positive cases and 2 deaths. Colonnade of O'Fallon has 2 positive cases and no deaths. Four Fountains in Belleville has 49 positive cases and 6 deaths. Memorial Care Center in Belleville has 43 positives and 5 deaths. St. Paul's Home in Belleville has 5 cases and no deaths. And Lebanon Care Center in Lebanon has 14 positive cases and 1 death. And for those of you who have been following with the daily briefings, you will notice that the numbers that we normally report for long-term care centers, the deaths have increased. I would just like to make you aware that those deaths have been already counted in our totals, and now we are attributing them to the facility that they had resided in before they went into the hospital. So just keep that in mind when we're reporting. I know it seems like a large jump. Those deaths had already been reported, and now we are just able to attribute them to the facility that they resided in. So now I will turn it over to Chairman Kern for his update.
Thank you, Sam. As we continue with this, numbers grow. We find out more information every day, and we report what we know to you. And so when there's changes, we'll tell you this is a change, and this is why. And I think all of that goes with why you watch this every day, because you're getting firsthand information hot off the press as accurately as we can get it. Our health department is in contact with all of the long-term care facilities, the hospitals, the testing centers, and they're compiling all these numbers, and Sam Bierman is doing a great job, and we appreciate her service. At this time, we'll go into the zip code reports. We've got some increases in certain zip codes today. 62201, we remain at 10. 62203, there are 14, which is an increase of 1. In 62204, there are 16, that is an increase of 1. 62205 remains at 17. 62206, there are 41, that's an increase of 2. 62207, there are 25. 62208, there are 32, that is an increase of 1. 62220, there are 42. 62221, there are 35. 62223, there are 29. That is an increase of 1. 62226, there are 65, and that is an increase of 2. 62239, there are 6. 62254, there are 12. That is an increase of 1. 62258, there are 13. 62269, there are 40. That is an increase of 2. And 62285, there are 6, and that number remains the same. So, as Sam talked about today, hospitalizations are up. And that, as we talk about getting businesses open and starting to get back to normal lives, all the experts are telling us you got to have 14 days of a decrease in hospitalizations. That's a good metric to use. So as you see today, we went up by 5. So we're still at this peak level. We still have to remain vigilant, stay home, do all these precautions. Remember to keep that log of people you're in contact with. As we test more and more people, including hopefully you, you'll be able to then feel good about your testing, and if it does come back where you're positive, you'll know who you were in contact with, so we can stop the spread and get back to our normal lives and avoid that second run at this thing, which is what a big fear we have is that we get lax, and then all of a sudden this is going to come back in the summer, and that's just what we don't need. And it's because we've got to get out and support our local businesses. After all this is over, we got to make sure those businesses are still around. And today joining us is the mayor of Shiloh. Sorry, I gave you, that was a little advanced knowledge of who's going to be on. So that should increase our viewership. Oh, you're not on yet. He's sitting here, but on the video in front of us is Shauna Odell. Shawn is an RN. She's the executive director of post-acute care for HSHS Home Care and Hospice of Southern Illinois. Sorry, Shauna, that I almost got you pushed back in the show a little bit.
That's okay. Thank you so much for the opportunity for us to come here and speak to our followers here in St. Clair County. We're just very fortunate for the community support as well and the adventures that we have to take care of our patients in the communities we serve.
So Shauna, tell us a little bit about what home care services, what those are, what's involved in what you do, and how you're interacting with your customers, your patients these days.
Yeah, home care and hospice, our primary goal is to deliver, high quality Franciscan healthcare into the communities and the patients that we serve in their home settings. For home health, that would be their homes, their assisted livings. For hospice, it may even be in our long-term care facilities as well as their homes, assisted livings. So wherever that patient may feel that they're at home, we focus on activities to improve their quality of life as well as increase their activities of daily living and keep them at the highest function that they can. So during a healthcare crisis like this, it's even more important to be able to bring that healthcare to the patients where they're at, rather than having them to have to come out. It remains them the ability to maintain that safe level of care as best as we can.
So tell us about your caregivers. Who are they, and how they interact with the people they serve?
Yeah, we have a multidisciplinary team of highly skilled clinicians. They do an amazing job in ensuring that all of our patients' needs are set and met. Registered nurses, physical therapists, occupational therapists, speech therapists. We have home health aides, licensed practical nurses, advanced practice nurses. All of these individuals are out meeting the needs of the patients in their homes.
So all the services that you normally provide are still going on, and if so, how are you able to do that? Are they wearing masks, those type of things?
Yeah, we're 100% operational. We're really trying to ensure that we can continue to meet all of those needs. I know a lot of patients are having to look for alternative care settings, and we are one of those that are still able to provide that. All of our staff, prior to working every day, we go through daily checks to ensure that we are symptomatic and are able to healthily help to be healthy and provide the care that we can to our patients. We screen ourselves for the symptoms as well as temperatures. And then every encounter that we have, we of course are wearing our PPE. We have masks as well as face shields that we do. In addition, we have another level of screening that we talk to our patients and their families the day before and the day of prior to us going to the home. And we screen them as well to ensure that themselves may be anti-symptomatic, as well as their caregivers or loved ones that they've been in contact with. And we continue to do that. In the event that we do have a patient who is COVID positive, we continue to provide that same level of care. We just even increase our vigilance even more than we already do, and kind of work with them to see if we need to make alterations in their plan of care to ensure that their healthcare needs are met. So depending on the variety of their symptoms, we just modify that plan of care in order to ensure that they do have all the resources that they need.
So what does a home care visit look like? Tell me, if I were to experience a home visit, what does that entail?
Yeah, you always starts off with a registered nurse who is assigned to you as a case manager. They evaluate your needs. They'll come to your home. We'll go through a complete comprehensive assessment, talk about your medications, kind of find out where you are in your healthcare journey, and how we can help develop a plan of care together to meet those goals, whether it's a short-term or a long-term plan of care. Things like IVs, wound care, disease education, diabetes management, congestive heart failure. So all our key diagnoses that we do. And we, along with the patient and their families, kind of meet those needs. If we identify that they may need therapy services to become stronger in order to continue to advance their healthcare goals, then we bring our therapist team members in, and they'll do evaluations and kind of go through the same process and evaluate that and develop a treatment plan, and ultimately collaborate with the patient's primary physician in order to ensure that we're meeting the needs of that patient.
Currently, are any of your patients COVID-19 positive? Are you doing any treatments for people who have the COVID virus?
We do, both in home care and hospice. We have had COVID positive patients and continue to meet the needs of those patients, as well as continuing to, and will continue to serve those. So again, we kind of have a protocol ensure the safety of other patients as well. Extreme vigilance on the infection control and who comes in contact. We have some dedicated resources that will be specific to our COVID patients, in addition to the general care that they get.
So the rules, I would think, on spread would then apply to the families of the people you're serving. So family can't be there when you're there, I would assume, and you probably put the rules out that people should be trying to isolate as much as possible.
Absolutely. We follow the same recommendations, staying at home, social distancing, wash your hands, don't touch your face. If you're sick, stay at home. We really talk with our patients to ensure that they don't have a lot of family members coming in and out. We are working with them that if they may need, meal services or pharmacy or groceries and things, we kind of help connect them with resources that have drop off, and in order to have really control that spread and decrease the exposure level.
So it comes down to your staff is out there every day. The hospice is a stressful enough situation, as is medical care. Are they seeing more stresses now, going to the homes? I guess it's one more thing to worry about.
Yeah, it is one more thing to worry about, but my team is amazing, and they are really working really well, and our patients are our priority, so we really haven't really changed our focus in that. So we want to make sure we meet the needs of that. The one thing that I can say is that community outreach and the support for all of these patients that are socially isolated is amazing. And so we have lots of individuals that are willing to help out when they can, and doing it safely and following the recommendations. So as a community, we continue to provide the great support that we do and work together to ensure that the needs of our citizens are being met.
Shauna, I think Herb Simmons has a question. Herb?
Yeah.
Hi, Shauna. Thanks for joining us today, and thank you for what your agency does. One question, how does a family contact your service? Or do they have to be recommended to you by a physician or what?
No, we will work collaboratively with the physician. So anybody who's interested in our service can contact us. They can contact our 800 number. Of course, off the top of my head, it's 800-551-6566, I think. But we'll get that out there so it can be posted. And then our website, any of those information, you can contact us, and we'll be more than happy to walk through any needs that they may have and work with the physicians in order to get those orders and get the care started that they need.
Very good. We appreciate you taking time today to come in and tell us about your service. Thank you.
Thank you,
You're
Shauna
welcome.
Odell.
Thanks for having me.
Yeah,
Thank
we
you.
appreciate you being here. We hope you come back. Thank you.
Anytime.
So as I alluded to earlier, we've got another guest today that we're going to talk to, and as the mayor of Shiloh, Jim Vernier does a great job, and during COVID-19, Mayor, can you tell us how things are running in Shiloh? What are the differences that you're seeing now from 2 months ago?
Yes. Let me first say thank you, Chairman, for having me and Herb. I appreciate the opportunity to speak on how things are operating and going on in Shiloh. But it's obviously our world is turned upside down as everyone else's is. But we're doing our best to continue to move forward and meet our residents' needs. Our municipal building is staffed again. It had been empty for about a month, but all calls were being forwarded. Occupancy permits are being issued. Home inspections are being handled. If a home is not occupied, we will go in and inspect that home. But if it is occupied, we will give you a temporary occupancy permit, and so you can move into your home, and we'll get back with you later when things settle down. In Village Hall, any other issues that you have, our number, you can Google it, call the phones, they'll answer them, tell them what your needs are. And if you need to come to Village Hall, you can come up there. If you got a drop off, you drop it off in the mailbox. But we're handling all requests for information and permits and things as we would normally do. However, you will not come into Village Hall. We'll meet you out in the parking lot. Our Public Works Department has continued to function, and with no layoffs, everyone has been working. They are all practicing social distancing. Fortunately, we have enough vehicles that they all ride in their own vehicle. But we're moving forward with projects. The street department is. And one thing I want to go back to as far as Village Hall goes, we were able to have all the staff in Village Hall at the same time because we have about 6 different entrances into the building, and all the personnel have their own office. So they're all separated by social distancing. We don't have cubicles, so everyone feels safe there. Our police department continues to operate, of course. Same thing, no one's allowed in the building. Non-emergency calls, they prefer to handle over the phone. Emergency calls, they will respond. If it's a medical issue, they will not respond until arrive or get out of their vehicles until the emergency services ESDA gets there. But they're getting along too. They just spoke with the chief earlier. We are in great shape with the PPE equipment for the police department. Our parks department is continuing to function. We have the parks are all open, of course, just like throughout the state. We're asking you to stay off the playground equipment. Our restrooms are currently closed. We're hoping that perhaps we'll be able to get those open. But for now, the restrooms are closed. Our walking trails are being heavily used. We had problems early on with when the closure occurred that kids were playing basketball, and we shut that down. We took the hoops down, and then of course they were playing volleyball, so we had to take the volleyball hoops down. But we haven't really had any problems there. I live very near our dog park, and I do notice from time to time that's heavily used, and I wish people would abide by the social distancing more down there. They may be family members, I don't know, but from my gathering, it looks like possibly they may not be. But
Have you had any COVID positive, or at least symptomatic employees, and how are you dealing with that? Because you're in kind of a, you're in a different position than many. You got to keep people working, but yet you have to deal with the fears that go along with, hey, my coworker is coughing today.
yes, thank you. That's a good question. Right after the whole shutdown occurred in March, we had one of our police officers with a slight fever. So they were tested for COVID. And at the same time, approximately a day or two before, two of our officers were called to a domestic complaint at a home, and those two were showing signs also. So they were tested for COVID. So our tests came back. Our officers are all cleared, but in the meantime, waiting for that, then it took 7 days. And as everyone knows, we were discussing earlier, our mental health is really being affected by this. In order to help relax our police officers and make them feel better, we had Service Master come out and disinfect our building, disinfected all the police cars, just more for peace of mind. We were pretty confident that they were going to come back negative, but you don't know. So we did that. But fortunately, no one else in the village. I know of no one personally in the village that has the virus, but there are some that do.
And certainly in your zip code,
Yes.
there are plenty. I saw a realtor the other day. We were talking. We were both in our vehicles, and she said that she's showing a lot of homes. Are you seeing permits in going up or going down, or what's going on with the economic activity?
The permits we're still issuing. We're issuing building permits, and in fact, last week there were two basements right on Greenmount Road that were dug. Homes are still being built. I can't say for sure that they're at the same level that they would have been had this not occurred, but what I can tell you is they're still seeking permits for homes and remodels, quite a few remodel permits. Commercial construction continues to move forward as well. Again, I'm not positive that it won't be affected some, but right at this point, I haven't seen it.
A lot of growth in your village. Census is important for people to fill out, and although we didn't talk about that earlier, I think probably this is a good time for you to make a case that if everybody hasn't filled the census out yet, they need to.
Yes, again, that's a very good question. I appreciate you asking that. Please, ladies and gentlemen, fill it, whether you live in Shiloh or any community, fill out that census information. A lot of you have time to do it because you're at home. Please do so. I thank my residents. Our percentage right now is at about 65% have already accomplished that task, which is about 5% higher than average. But please do so, because what you may not realize, you may think that's just an aggravation or government intrusion, but it is how every community gets federal dollars assigned to them by population. So please do the census, and if you have time, do it sooner rather than later.
And those motor fuel dollars and other monies that flow, that's real important. And even more important, how much do you think sales tax is off? Do you have with COVID, people not being able to shop, many of your stores, being limited on hours or closed? Do you have an idea what the shortfall is going to be?
Well, Chairman, I wish I did, because we receive our funds 3 months after they're collected, so we don't see the downtick in the sales yet. And one thing about Shiloh is our two biggest businesses are Target and Deerberg's. That's the majority of sales tax right now in Shiloh. We have a lot of restaurants and smaller businesses that are certainly have been closed, so there's no sales tax being paid. But on the bright side for us, the grocery store and Target lots are packed. I mean, it's hard to get in the stores. So it's possible that we may stay right where we would normally have stayed, but the businesses have really been impacted, all the small businesses. So please, if you can, support the local restaurants. They're still serving to-go orders, or you can get delivery. Some of you may not know the different delivery services, but they're out there. And support your local restaurants in all of your communities, because those people really need the business to, number one, to make sure that they stay around and don't close. But number two, their employees, they're not at the highest pay scale, and they can really use that income.
Mary, you've been on we do weekly calls as we talk about here, and we appreciate you always being on the call and having good advice and sharing advice with all the other mayors. You guys are a team, and we appreciate your input there. We also appreciate the fact that when you need PPE, you give us notice so we can put those orders in, and we really appreciate how Shiloh has been a member of the whole team as part of this.
Chairman, vice versa. It's a ditto. You guys have been fantastic throughout this whole thing. There's not one of us here wish we didn't have to go through this, but we are, and you're doing yeoman's work at making sure everybody gets what we need and doing your best to keep everybody comfortable.
So we'll see how you feel after the hard questions come, because Herb Simmons is always the great interrogator.
No, we talk all the time, Mayor, and I appreciate you coming in today. And as the chairman said, your participation on those weekly conference calls is really appreciated, and the suggestions and advice you always give is good. There was one question that came in. I think Shiloh just had something with the open burning. There was a call wanting to know if that's been expanded throughout the village or what. Can you talk on that?
Well, sure. Our community still allows burning of yard waste. And by that, I mean dry tree branches that fall off your trees. Remember, if you live in a subdivision in Shiloh, and most of our subdivisions are covered by restrictive covenants, those are not changing. You're not allowed to burn in your subdivision. But if you live on the farm and south end of town, Tamarack Golf Course is actually, we've had a no burn at the request of the fire department since the virus started, but they relaxed that just the other day. And the golf course has quite a bit of tree debris from winter that they asked if they could get it taken care of before the course opens up. And so the fire department did allow them to do that. But that's, fortunately, Shiloh also has a lot of large, rural areas, and so those people continue to burn. I have 3 acres, and I'll be honest with you, every once in a while I burn my tree branches too, because we don't have landscaping pickup in Shiloh. But fortunately, our subdivisions are all mostly new. We don't have a leaf problem. It's mostly just tree branches, and it's mostly on larger properties that are requesting this.
Well, good. I think that clears it up, because there was several questions that came in. I guess there was a post that was put out, so
Yeah.
we got that question answered for you. I told him you'd be in today so we could get it cleared up.
And Herb, if I could just say one more
Sure.
on that, remember, that's for stuff that you can burn that doesn't make smoke. Do not grab a bunch of wet yard leaves and try burning them, because if that makes smoke, the fire department and the police department will be at your home. Just remember that. And that goes all the time, not just now.
Very good. Thank you, Mayor. We appreciate you coming in.
Thank you,
Thank you
Herb.
very much.
Thank you, Mayor, very
Chairman.
much.
Appreciate it.
And it's always good to have somebody like the mayor to come in and tell their side of the story on what this is meaning to all of us. And just to go over some of the EMA stuff as we do every day, a conference call with the hospitals and EMS went well again today. We had a conference call with the IDPH, getting all the information from them, confirmed the scheduling of PPE facility to some of the long-term care centers in St. Clair County. We're really looking forward to that. Received a shipment today of some disinfectant, so we'll be contacting our first responders and getting that started to get deployed tomorrow. And then real quickly, I wanted to give a thank out. I think I mentioned this the other day, but Rick Herzog had come by. Chairman, this is what I was telling you about. He had actually took his stimulus check and wanted to give it to the first responders, so he brought by, but he wanted us to just make sure we let everybody know it was given in the memory of Judy Herzog. So we appreciate that, Mr. Herzog, and we've got the cards here, and we've already coming up with a plan on how we're going to get it out to some of the first responders. So I thought that was really showing us that there's a lot of good people in St. Clair County out there. You heard Sam Bierman talk about the numbers. Again, we talk about them every day, and we don't like doing that. But here in the county, 26 new positive cases today. Statewide, 2,253, 92 new deaths. Ponder those numbers for just a minute. I want to read something to you here before we leave. And it just really says, I wear a mask in public, not for me, but for you. I want you to know that I'm educated enough to know that I may be asymptomatic and still give you the virus. No, I don't live in fear of the virus. I just want to be part of the solution, not the problem. I don't feel like the government is controlling me. I feel like I'm being a contributing adult to society, and I want to teach my children the same. I want them to grow up just as I did, knowing the world doesn't revolve around me, that it's not all about me and my comfort, that if we all could live with other people's consideration in mind, this whole world would be a much better place. Wearing a mask doesn't make me weak, scared, stupid, or even controlled. It makes me considerate. When you think about how you look or how uncomfortable it is, or what others think of you, just imagine someone close to you, a father, a mother, a grandparent, aunt or uncle, choking on a respirator or a ventilator. Then ask yourself if you could have sucked it up just a little bit for them. So stay home and stay alive. I think that sums it up pretty quick there. We'll be back here tomorrow, a daily briefing, and we'll be back momentarily with Cindy to translate this to our Spanish communities. Thank you.